doesn't feel normal.
It's probably IBS or something like that.
Something is definitely wrong. Honestly, I had no idea it would be cancer.
I just never thought cancer would ever be the thing.
Basic pregnancy constipation, hemorrhoids.
I knew definitely that something was wrong. These young women, all diagnosed with colorectal cancer. Hi, I'm Taylor, storyteller with the patient story and a daughter of a colorectal cancer survivor. What is colorectal cancer, though? The American Cancer Society says the disease starts in the colon or rectum, which makes up the large intestine in our bodies and is part of our digestive system. March is Colorectal Cancer Awareness Month. It's a month that is so important to me and my family, as my mom was diagnosed with stage 3 colorectal cancer in November of 2023. Here are 5 signs of colorectal cancer straight from patients that we've interviewed here at The Patient Story, plus tips from a colorectal cancer surgeon.
I've seen an uptick in the younger age group. Right now, you have a higher chance in this country of getting colorectal cancer.
I always thought it was just like the travel constipation. And because anytime we would travel, I could never go.
So the first symptoms that appeared were about 10 months before my diagnosis. And it started as kind of like mild constipation and just, it almost felt like I wasn't able to digest food.
I tell everybody there were no signs, and none that I would have been aware to recognize. I did battle constipation. However, I have battled constipation most of my life. It was nothing new. And I was reaching the age of perimenopause. And I knew that was also like your digestive issues go along with perimenopause. And so I thought constipation was just part of my life.
Towards the end of my pregnancy, I had what I chalked up to just basic pregnancy constipation, hemorrhoids, and I didn't really think much of it, but I remember distinctively towards the very, very end, I'm talking 2 weeks before my scheduled C-section, I had an episode of bleeding, and I, at the time, didn't really know where the blood was coming from. I did have a little pain on the right side when I would digest food sometimes. I'm like, what is that?
I had blood and mucus that I was passing. And so that was kind of a big worry immediately. And really, I think we just all thought it's probably IBS or something like that.
I've had IBS symptoms my whole life, on and off, but they would come and go. So they were kind of normalized, which was unfortunate. 6 months before I got diagnosed, my IBS symptoms started flaring up. And usually what I would do is I would cut dairy, I would cut coffee, and I would see some improvements. And I did see some mild improvements.
So I was diagnosed with IBD or ulcerative colitis when I was just 15 years old. It was just a couple weeks before my 16th birthday. And I lived with IBD for about 25 years before my colorectal cancer diagnosis.
The initial thought was maybe it's IBS. So I was taking those two, the iron supplements and IBS medication. I remember at the end of June of 2024 was when my symptoms just really took a turn for the worst.
I thought I had IBS. And then the doctors, I would just hear well, no, you're fine. All your labs look good. You're too young for anything.
I started having blood in my stools. And that's when I thought something is definitely wrong. So booked an appointment with my doctor. My doctor was aware of the IBS symptoms, but, being a woman in late 30s, we're always sick. We always have symptoms. We have a lot of hormone stuff going on. So we didn't look into it any further. She booked me for colonoscopy end of December, and that's when they found the mass in my colon.
There was blood in my stool. That was a huge red flag for me. I knew definitely that something was wrong.
I had recently visited my OBGYN. I saw her at 50. She told me I needed to have a colonoscopy. And I said, yeah, it's time. I had watched my husband go through one at 50 and didn't think anything about it. But it wasn't long after we had just started going back, opening up after COVID. And so I didn't get a call from them. So when I went back at 51, she said, did you not get a colonoscopy? And I said, no, they never called me. And she said, no, we're going to take care of this right away.
So before my diagnosis, I was experiencing, a lot of like going to the bathroom, and there was abdominal pain and cramping.
I was just like bent over at work in just so much pain. And I was dealing with I would only have relief if I would try to go to the restroom. But after I ate, I was just always in so much pain. And so I finally called a gastroenterologist. I go in for my colonoscopy and endoscopy. I wake up in the middle of my colonoscopy because I hear them say cancer.
Whether or not you have any of these symptoms, 45 is the recommended age to start getting screenings. Let's check in with an expert, Dr. Z. He's a colorectal surgeon in Los Angeles, and here's his breakdown of what you should look out for.
Number one, changes in bowel habits mean that, hey, I poop like clockwork every day. Now, over the last 2 to 3 weeks, despite me taking laxatives, I notice I'm going once every 3 to 4 days, and it's very hard and difficult to push. Change in bowel habit. That's something that you need to see your doctor for. Blood mixed in stool or rectal bleeding that doesn't get better over the course of 2 weeks with over-the-counter. Doesn't mean it's cancer, but it means you need to see your doc. Abdominal pain that is persistent is another reason why you should make sure you see your physician. These are things that could happen with colon cancer, but they can be with a lot of different diseases. And so really being in tune to your body, but also, and it's easy to say, but try not to be so scared that you don't go to see the doctor, because then you can have self-fulfilling prophecies. And that's really the biggest thing, is that, the warning signs are nondescript. But the good part, if there's any good part about this disease, is that it can be prevented.
According to Yale Medicine, colorectal cancer is now the #1 cause of cancer mortality in Americans under 50, surpassing breast cancer and other cancers. And a new study was released in 2026, evaluating the consumption of ultra-processed foods and the risk of early onset colorectal cancer.
I've seen an uptick in the younger age group. Right now, you have a higher chance in this country of getting colorectal cancer if you were born in the 1990s than if you were born in the 1950s. Okay, I've operated on some young basketball players. I've operated on athletes. I've operated on a large population of patients younger than 45. Now, colorectal cancer in general has leveled off and has actually decreased in this country, but we've had a 12-fold increase in young people getting it. I always say that that's the gift and the curse when I talk to my patients. I always say, yes, cancer sucks, especially when you're young, but when you're old, it sucks. But you're also strong enough to fight it. Now, it's hard. One of the biggest things, and this people don't think about this, is that what's really good about this younger generation, and I know I'm getting older because I say things like this younger generation, but is people are really open about mental health. And I make sure every single patient who gets diagnosed, period, but let alone my younger patients, number one, see a mental health therapist. And so one of the things I love about your organization, and one of the reasons I'm here, is for patient advocacy.
Getting a cancer diagnosis is absolutely heartbreaking, but there is hope.
I'm tired of people telling me that I'm brave, because what other option did I have? People really don't know what to say, what to do. And so it can be really isolating. But I think I would tell people that it is going to be okay.
Never give up, never surrender. And I think that kind of quote sticks with me a lot because of him, and because of him giving me that book at a difficult time. And I think that's really kind of the mindset that, to a certain extent, you have to take with cancers. It's a lot of different choices and different kinds of things, but you just can't give up and you can't surrender to it.
I try to encourage my girlfriends, when they feel symptoms, and people just don't delay. Colonoscopy is the gold standard in finding out if you have colorectal cancer or not, so just do it. Thankfully, a lot of people around me took it seriously and went for colonoscopies.
Be sure to really advocate for yourself, especially in those medical offices. Two, this journey is not easy, regardless of where you're at, stage 1, 2, or 3, regardless of your prognosis. And so being able to be outspoken about it is completely okay. It's hard. Sometimes you just have to kind of ride the motions and get through it before it gets better.
And I had a friend ask me, how can you be so hopeful? How are you holding on to your faith? And I'm like, well, what's my alternative? If my alternative is despair, do I want to spend the time I have left in despair? No, I don't want to spend a moment in despair. And it's really made clear to me, like, if before my diagnosis, I was conscious of making every moment count, it was in a different way of making every moment count now.
Thank you so much for watching this video. We've queued up a patient story right here for you. And please make sure you subscribe here to join our community, where we're humanizing cancer and always reminding people you're never alone.